This is QD Clinic. Hi, I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.Live, where great meetings are attended by great rheumatologists. That would be you. March 18th and 19th, I think you're going to like our TED-like talks that are spread throughout the program. A few. One is The Future of Osteoarthritis from Philip Conahan. It's going to be great. Second, why medical meetings should be like October 1st, Dr. Henrik Schulz-Koops. And then a session by rheumatologists, a father-daughter pair, who are going to talk about the family rheum, RHEUM, meaning it's all in the family with rheumatologists. Guess who those speakers are going to be? I expect to see you there. Let's talk about a case. This is a case of belly pain, polyarthralgias, and poor diet. A 54-year-old woman presents with a 10-year history of belly pains, weight loss, nausea, previous gallbladder surgery, going to pain management now for chronic belly pain. She has sores in her mouth that are painful. Her eyes are red and scratchy. She's seen ENT and GI, and they don't really have much in the way of a diagnosis. ENT tried to make a diagnosis of Sjogren's, and it didn't stick. Nothing could be found, including a negative salivary gland biopsy or lip salivary gland biopsy. She has chronic polyarthralgias, arms, legs, shoulders, hips. She's overweight. She hates... she has a bad diet. She hates fruits and vegetables. She's been diagnosed with hypothyroidism, gastroparesis, back pain, and degenerative joint disease. She's taking pain meds, narcotic meds, and not doing any better. And on exam, she mainly has trigger point tenderness, mild osteoarthritis, and mucositis. So the question is, what does she have? And I'm going to throw a real red herring at you. This is a case of scurvy. What? Are you kidding me? And yes, she had lab tests to prove that she was deficient. It's more common. It's not common in the United States, and when it is, it's really the result of a really bad diet. It's seen outside the United States and seen people with psychiatric disorders or alcoholics or those with incredibly bad diets. The manifestations of scurvy are very protean, fatigue, anemia. They have problems with bleeding and capillary instability, so they have purpura, hematomas, poor wound healing. They have a lot of GI symptoms that could also be for the same reason. But when you look at them, they have myalgias. They rarely have synovitis. They usually have arthralgias. And they usually have a very high SED rate in CRP. They may have dry eyes, dry mouth, and scratchy eyes that look like Sjogren's syndrome. And if you look at their gums, they'll have hypertrophy of the gums and usually very, very poor dentition. So here's a case of scurvy. And it turns out when I presented this case a few years ago that in the next month I saw a bunch of cases of scurvy in our literature. And you should be aware that this is something that you should look for. So get back on those fruits and vegetables, and consider this, especially in patients who have ill-defined symptoms with a lot of GI symptoms, and I think hematomas and purpura and mucositis. Those are strong clues for scurvy. Tune in for more QD clinics. We'll see you at RheumNow.Live.